Hi, my name is Rebecca. I'm going to be your student nurse for today. Can you tell me your name and date of birth? Sue Quinn, 7/21/1951. Very good. And do you have any allergies? Levofloxacin and strawberries. All right, that's exactly what I have. Today I'm going to be putting a urinary catheter in you, and so now I'm just going to get some things set up for it. I'm going to go ahead and put some gloves on and clean my table real quick. And I'll just do this for 2 minutes according to what the bottle says. A lovely one. Let me get the sides. Raise it a little bit. Okay. And this is in the room. Go ahead and do my hand hygiene. And then I go ahead and position the patient. And I would note that pericare needs to be done before the catheter is put in place, but for right now we're going to say that it was already just done, so we don't have to do that right now. And I'm going to open the legs. And I make sure to only expose what I need to. Okay. I'm going to go ahead and place this biohazard bag over here. I could also do the vital signs of the patient if need be, and assess their pain. I'm gonna do my hand hygiene one more time, and then I am ready to open up the package. And then I can go ahead and open this up. Making sure not to touch anything. Okay, and at this point, I'd be ready to put on my sterile gloves. I'll go ahead and do hand hygiene one more time. Just precautions. Actually, I'm going to go ahead and raise up the bed real quick too, so it's an easier level for me to work. Okay. All right. One more time, and now I'm ready for my sterile gloves. Okay, now I have my sterile gloves. I can grab what's in here, leave the 1-inch border, First thing I'm going to do is apply this drape. I'm going to fold it corners under my hands, making sure not to touch the patient with my sterile gloves. And I think I did a pretty good job of not touching anything on that. Here's the actual sterile gloves that were covered up. And here's my other drape. There's two. Go ahead and place it right there. Okay. And there's actually another one. So I guess I'll just put it over the top just in case. Okay. I made sure not to touch anything else. I could tuck these sides down a little bit. Okay. So now I can take this tray out. And I'm going to go ahead and open up this. Okay. I'm just going to put this in the trash because I'm done with it. Okay. And I did accidentally get a bit of betadine on this. The good thing is it's a cleaning thing, so shouldn't really affect it. I could probably get something to clean this off, have someone give me sterile towel or something to clean it off, but for these purposes we're gonna keep going because I didn't break sterility or anything. I'm gonna put the lube out here, get it ready to go. And I really want this not to be on here, but like I said, for the purposes of not having anything else, I think it'll be okay. I didn't, it's not inside of it, so and go ahead and make sure there's no air bubbles. That's screwed pretty high. I'm gonna put it on the end. So we hear that noise. Okay. And that is really making a mess everywhere. Probably could change my sterile gloves because I have another pair. But I think we're gonna try to keep rolling with these. Okay. So now I could go ahead and get my end of this in the lube ready to go. And then I want to go ahead and clean off the patient. So I'm going to put this hand on the patient, and once I do that, I have to leave it there the whole time. So there we go. It's dirty now, and now I'm just going to swipe the furthest side away from me and get rid of that. Then I'm going to clean the side closest to me and get rid of that. And now right down the middle. And get rid of that. Okay, now I'm ready to bring this over here and get ready to insert the catheter. Okay, and I have this end, and I'm just going to insert it. About 2 to 3 inches. Okay. And then it's not stopping me, so that's a good sign. I'm going to go ahead and inflate my balloon slowly. And I know that I have to put 10 units in because that's what it says on the green part. Slowly inflate the balloon. Very slowly. Okay. And the next thing I'm going to do is try to pull it back and make sure, nope, and I can't do it because of the balloon is there and it's good. So next thing I'm going to do is, well, actually, I could have let go and held this when I went to insert the balloon, but I didn't do that, but I'm verbalizing it now. So now this doesn't have to be sterile anymore since the balloon's in place, the catheter is in place, so now I can go ahead and take it out of the sterile field. This doesn't need to be sterile anymore either. So before I do that, I'm going to clean off my gloves because these are dirty. Hand hygiene. I'm just going to put new gloves on. Okay, and I'm going to grab my tape too while I'm at it. And tape this on. So I know it's secure. Go ahead and rip this off. Okay, if you want to come around here, I'll show you what I'm going to do with this. So you want to make sure the cord doesn't fall below the bag. So you'll hook up the bag to the side rail so you can see it, and then go ahead and put the leg down. Coil the line right here. At this point, you could assess the urine color, everything else you need to do with that, and I would just finish cleaning my patient up. Do any further assessing if need be, make sure they are covered up, and really just clean everything up. So yeah, that's about it.